Welcome to the DecisionWise Engaging People podcast. Today's topic is on navigating employee burnout in a COVID-19 world. It sounds very apocalyptic. Today is May 14th, 2020. We are a month and a half, 2 months into the quarantine here. My name's Charles Rogel. I work as a consultant here at DecisionWise. I'll be moderating our conversation. Joining us is Spencer Taylor, one of our consultants here at DecisionWise.
Hello.
And Matt Wride, our president.
Hi, Charles.
So as we jump into this topic, let's first kind of define what we're talking about in terms of burnout. Spencer, do you want to chime in on this one?
Absolutely. I took a look at I kind of turned to the scholars for this one, just looking for some of those definitions and a couple of the just phrases that stood out to me. This first one, burnout is affective reaction to ongoing stress whose core content is emotional exhaustion, depersonalization, and reduced personal accomplishment. I think that's kind of a really good place to start. The second one, burnout is a psychological syndrome emerging as a prolonged response to chronic interpersonal stressors on the job. The three key dimensions of this response, and I like these three. I think we'll probably end up touching on these during our conversation. Overwhelming exhaustion, feelings of cynicism and detachment from the job, and a sense of ineffectiveness and lack of accomplishment.
Yeah. You know, as I did some preparation as well, I found that the academics were breaking burnout down into activation, meaning what do we do to activate people and keep them engaged in their job, and then how do we help them decompress? And so ultimately, the correct thing is the proper balance. The cycling between those two types of things need to happen regularly, and in times of non-stress, we go to work, we activate, and then we decompress. Mm-hmm. What happens in stressful times is there's very little decompression and a lot of activation.
Yeah.
So it'll be interesting to also explore that along with kind of the concepts that you've introduced.
So at DecisionWise, we're in the business, of course, of conducting employee surveys, measuring around these topics. And what we wanted to talk through or share with you today are some ways to measure employee burnout in your organization, actually share with you some questions, kind of deconstruct them a bit, talk about the concepts we're trying to measure, understand, and then also how to respond as well to your data.
I think one just quick thought here at the beginning, I was just kind of scanning headlines earlier, like I think a lot of us do more than we've done in the past, perhaps. Just in the New York Times, there were a couple of articles. One talked about a UN memo that's come out warning about a plague of mental illness that's going to come, potentially because of all this. There was also a picture, a separate article, just emphasizing the kind of the impact on children. If healthcare workers burn out, we'll probably touch on healthcare today, because that's one of those things where a lot of us are thinking about, and thankful for those who are serving there. But if they burn out, then this picture of these children with their parents waiting in this big long line, and the article pointing out that they may not get care if there's not a provider on the other end of that line. So anyway, I think that gives us a chance to see the potential impact of influencing this in a positive way. If we can help reduce burnout, there's this positive ripple, I think, that can affect a lot of lives in a meaningful way.
And there's no shame in talking about burnout or acknowledging burnout. Mm-hmm. I think sometimes we think it's a badge of honor that you just keep shouldering on. And Stephen Covey, one of the, here in our area, was a leader in this field, and he often referred to sharpening the saw, taking the time, one of his 7 habits. And I just want to dispel the notion somehow that it's better to suffer in silence. It's just hogwash.
Agreed. So what we'd like to do today is share with you 10 questions that we've used to measure employee burnout and workload, and talk through them, discuss what we're trying to measure, the ideas behind them, and really give you some insight in terms of how to use these to both measure this concept and respond to it effectively. The first one is pretty simple. It just basically asks, or the statement is, my job makes me feel energized. And so if you could picture an employee survey and answering this, the scale would be strongly disagree to strongly agree on a 5-point scale. And the question again, my job makes me feel energized.
Yeah. So just to step back, we've been using this Pulse now for a while. Some of these questions have been on our healthcare provider burnout survey that we do, because that's something that's always on the top of minds of healthcare organizations. But we're seeing this now, obviously, in a COVID-19 world apply, and this notion of my job makes me feel energized. This is obviously one of those activation questions. How is my job engaging me personally? I like it because it's measuring, again, it's positively framed, but it's measuring more than do I like my job,
Right.
more than am I satisfied with my job. It talks about the energy you gain from your job.
Uh-huh. Yeah, as opposed to it feeling tedious or regretting going to work in the morning.
Well, sure, because there's always stuff or parts of our job that we don't like.
Mm-hmm.
But overall, are you energized by what you do? And it's a good question that way.
Yeah.
I like that as well. I just was thinking about, we have some variations of similar questions in the overall engagement survey. One of those is most days I enjoy coming to work, or most of the time I love my job. There's kind of some different ways to say that. But I think this energized is a pretty key word in this context of trying to measure potential burnout. Because if you don't feel that deeper energy, you think of the person coming right out of a graduate program, excited to leap off into their career. They feel energized. I think we all kind of have bumps and moments where we feel that way more than not. Mm-hmm. But one of the pre-indicators, or I guess the kind of leading measures of burnout, I think is captured in that, if that goes low.
So the second question here is, I have enough energy to pursue non-work activities after work?
Wow. This is something that's important to me. It used to be, I think, a few decades ago, we thought of people as either their work person or their home person, or their person, and they didn't meet. And now we obviously carry cell phones in our pockets, and we're always constantly checking in with our job. But sometimes I think employers think that when you walk through the door, or when you're on your work from home schedule, that you're not suffering from the effects, that somehow you're different, that you can put on a cape and all of a sudden be Superman. And when we hire people, we hire the whole person.
Yeah.
We don't hire just the work person. We hire them, and we've got to be cognizant of that. And that's what this question gets to is. Sometimes employers are like, well, I don't want to ask a question like this because I don't either really care, and that's a cynical way, but I've had people say that, or they don't want to introduce or give the notion that they're somehow responsible for what people do after work. But we're not saying we're accepting responsibility, but we do care. So.
Well, and when we're living in a world, earlier you mentioned the activation decompression model, and this one fitting into decompression, a world where there's literally no space for the decompression other than sleep. Sleep is not enough of an opportunity to truly decompress.
Yeah.
I've never worked in healthcare, but I did serve in the military early in my career, and during a couple of the combat deployments, we were working over 12-hour days, 7 days a week, typically, and downtime was basically you're expected to do up to an hour of exercise, sleep and eat, and that was it. And so it often led to soldiers burning out, service members, I should say, other branches besides just the Army. But it was a very real thing. And in that environment, there was combat stress on top of that with a threat to life, a direct threat to life. And anyway, so it was interesting to just see that dynamic and try to help manage that. I was invited to help kind of mentor some of those that were more impacted, had a harder time navigating that. And I noticed that even small things, as simple as it might seem, like spending 20 minutes playing a video game or doing something, talking to a loved one on the phone. Often that's not possible in that environment. But anyway, those little activities just that represent a disruption of the monotony and of the grind. And I think, again, with appreciation of our healthcare workers, law enforcement, all those that are putting in so much of that direct work, that they have very little time. But it doesn't take hours to decompress. I think it can be done in a more concise way.
Did you find that there's where you need to have a certain amount of overall time? Like maybe it comes in 20-minute increments, but do you have to add up and have a certain amount? Like with sleep, you sort of eventually feel like you almost have to catch up. What were your findings there when it came to decompression time? So was it always just quality that mattered, or was there also a quantity component at some point for the soldiers?
That's a great question. I do think it's a balance between the two. Right. I think quantity at some point, as you kind of indicated, has to come in. I think that's actually part of why the military is pretty good about the R&R, the leave you get during a combat deployment. It's not so much that they want to, as this might seem uncaring, but it's not that they really want you to see your family necessarily, but it's that they want you to go and kind of reset. So you come back and you're fresh again, and you can give more of that fresh effort. So I think that's kind of the quantity part of that.
So next one's related to this one we just talked about, and it's, I do not feel emotionally spent after work.
Yeah, it's phrased strangely. I do not feel, but that's because we try to keep all questions framed the same way.
Yep.
And so when you agree, that's a positive response. So I agree that I am not emotionally spent. So again, but I mean, how many times have you gone home and you felt emotionally spent?
Right.
And and then you wonder if you're going to be ready to do your best work. I wanted to share a story with you guys, and I kind of mentioned it in our prep time as we prepared for this podcast, but when I was working long hours for Deloitte, I had a really great boss, and she would send us home. Really, you could be there all 24 hours a day sometimes during the busy season, and she realized that we would just start making mistakes, and that we were presented more liability to the firm, and were probably a greater risk if we stayed and tried to do all-nighters than if we went home, slept, showered, ate. And really, I think, after 12, 14 hours, you really see a drop-off. I mean, at 18 hours, you can, in short stints, you can do it. But I've never found all-nighters to be effective. I think back on when, it was so great for, interns, doctors, residents to say, oh, I've been at this for 72 hours. I'm like, is that a good idea? Do I really want to have you stitching my face up when you've been, awake for 72 hours? So.
Yeah, I can't imagine... just maybe I have healthcare overly on my mind today, but just thinking through when it's mandatory, essentially, when there's no one else to fill your shoes, you've got to pull that back to back, and you're at the end of your rope at the first half of that. How do you continue? And I don't have a good answer for that. I'm just mostly trying to kind of think through that and be grateful. And again, part of the idea here, as we talk about these questions, is that measuring where organizations are now is a great starting point, so they have somewhat of a baseline. And then measuring again after a short period of time, you can have some type of indicator as to whether risk of burnout is increasing or decreasing. And I think there's value in doing that multiple kind of check-in with these 10 questions.
Before we go back to our questions, I want to just add a couple more that are decompression ones.
Yeah.
I'm able to free my mind from work when I'm away from it. I can enjoy my personal time without focusing on work matters, or I'm able to disconnect from work communications during my free time. Those are other options or variants that clients could consider using, and that would be really good information to give back to managers so the managers could see whether they're overwhelming their team. A lot of times we've discovered a manager, for example, will send out an email at 11:30, and it gives the impression that they want an immediate response, but maybe she's simply just thinking of it.
Yeah.
Sends it out, thinks it's just, I've got it in the queue. Meanwhile, there's 3 people at home going, what am I supposed to do with this?
I need to jump on that right now?
Yeah. So that's one of the things that we always try to guide our clients is clear expectations. Just take the time and tell your team what you mean. If you receive an email from me at 11:30, what does that mean? It means that I thought of it, and it's okay. You can ignore it. Ignore it till the next business day. It's just fine.
Yeah, that's a good point. So these next questions deal with kind of customer interaction. So this one here is, I have positive feelings towards those I serve. And you can think about this in healthcare where, patients obviously, but maybe it's customers. Maybe if you serve internal departments, who your stakeholders, your clients, your customers, everyone has them. And so sometimes, obviously when you're getting burnt out, you might develop some emotions or maybe attitudes towards the people that are demanding your services.
Yeah, I just was thinking back on one of the other definitions as we began. I shared a few of those. Ties into the depersonalization, where you're disconnecting from the human element of your work. And so I think this kind of helps draw that out a bit and see whether that's taking place.
It's a red flag. If your team is starting to criticize your clients, you may need to, you're probably heading into burnout. Because when you're happy and engaged, you're not really criticizing your clients. But when we've done it, I can't, they're the worst.
Right.
When you start hearing that and you start having these commiseration seances together where you're like, oh my gosh, they're the worst. It might be an indicator that you're
got too much to do.
Maybe that you've been on that client too long or something. It's just a chance to check out burnout.
Yeah, because when requests are viewed as extra work or too much, then it starts to turn towards the customer. So another one similar to this then is I care what happens to every patient/customer/client. Student, yeah.
Whatever.
So I care what happens to every client or customer. Again, tied to the same one, if they feel like they don't really care, sometimes I experience that at a restaurant in the airport, but it just depends. That customer interaction suffers, especially if you have an organization with a lot of customer, patient-facing employees.
And one of the things that we do when we're trying to measure engagement surveys, we're trying to understand how people feel a sense of meaning and purpose in their job. And when you're far away from the customer, it's easy to kind of, you don't sense this every day. Like if I'm a healthcare provider, I'm going to touch that customer. I'm going to see some impact from what I do. But if I'm a software engineer and I'm working on a discrete part of a data model for a piece of software that I never really see the end user use, that's where managers, engaging leaders, engaging managers, they connect the dots. And they take the time so that software engineer in his or her cave with the Nerf guns and all of the nerdy stuff around, they see how they're impacting the customer.
Yeah, I like that. I think about that in the context of, I call it the proximity principle, but just how many levels removed is that person from the customer experience? As your earlier example, we work with some blue-collar organizations, for example. If they're pulling products off of a shelf in a warehouse, they never really get to see that product make it into the hands of a happy customer, something like that, then they're a few degrees removed. And I think it takes some intentionality to really connect the dots so that there is a clear understanding that act, as small as it may be or segmented as it may be in the software development example, that's a great descriptor there. It does have an ultimate impact in helping them, I think, see that illustrated in that meeting.
So next one, again, customer related. I treat every customer/patient or client as an individual with unique needs.
Yeah, and I think we could comment on each one, but I think that we touched on that one already.
Yep. Next one's one that we use on several surveys. My job provides me a sense of meaning and purpose.
You tell the story of that, and we've shared it before, but I think it's our best story of the food service worker in the healthcare organization.
Yeah, and so this is kind of part of our training that we do around employee engagement, where as we were delivering this training, we call it our magic training, it was to a large group of healthcare workers in a hospital. And one of the nurses said, well, I understand how I experience meaning and purpose in my job, but I don't quite understand how someone that is on the janitorial staff or in dietary or any of these other positions that don't serve patients would necessarily feel meaning and purpose. And out of the audience, one of the managers over the dietary team got up and said basically that when people come to the hospital, they're not there for a very good reason. No one's having a good day essentially when they're in the hospital room. And so our team is able to provide a hot meal and a smile and a conversation to these people who otherwise are just there getting poked and prodded and tested. And this is kind of the highlight or the bright spot of their day. And so their whole team was enthused in order to, in a way to provide kind of the sunlight to these patients who otherwise are having kind of a miserable time.
It's just interesting perspective. And if I recall, there was an ovation.
Yeah, standing ovation for her.
Because, and that's here locally, we have Intermountain Healthcare and a leading hospital system. And their CEO says that everyone's title is caregiver, whether you're an IT professional or you give care, because everything you do is about that. And I think that does help drive a sense of meaning and purpose.
Okay, another one kind of about customers here. I find joy in being able to help patients, customers, clients?
It's an interesting word, joy.
Yep.
It's there on purpose. Sometimes we use words that are very polarizing. For example, you know how we debate the question, overall, I love my job.
Mm-hmm.
But we use it because there's a big difference between love my job
Right.
and like my job.
Yeah.
And there's a big difference between I like being able to help patients and I find joy. So as you think about what we measure, we really are trying to trigger an emotional response.
Yep. This one's a really simple question. My work makes a difference, similar to the meaning and purpose question we just asked, but my work makes a difference.
Frankly, if I were a manager and my organization was not doing this survey, I would do this. I would take these 10 questions. We'll make them available for as the podcast goes out. We can have a download to them. I would run this on paper, and that would be that question. This is the 9th question. My work makes a difference. I'd be wanting to know what people responded.
And this is really the I in our impact, or in our magic model about impact. So again, people are energized when they're able to make a difference. They're not just doing monotonous work. Last question here. I am pleased with what I can do to help patients or customers or whatever. So again, slightly different. It's more of an empowerment question, right?
Yep.
It's a slightly different take on what we've been asking. Because if you are not empowered or you don't have the tools or whatever, you can't help people. That's very frustrating.
I saw a quote in a signature block, actually, of one of our clients that we're doing some 360 work with. I'll just share a brief part of it here. And I think it kind of summarizes, it touches on this 10th question, but really the spirit of each of the questions. Again, I'm summarizing. It's a little bit long, but the quote talks about there are 2 kinds of people in the world, window people and mirror people. Mirror people basically look in the mirror and say, what's important to me? What about me? What can I get, kind of a deal. Window people, on the other hand, measure success by the contribution they make into the lives of others. That's attributed to Kirk Cousins. So I quite like that. I think that ultimately is a lot of what it's about. It's building this personal resilience of seeing the world that way. And then I think it allows us to serve with a little bit larger gas tank, I guess. There's a little more capacity to continue going if we see the world that way, as opposed to kind of the what's in it for me.
Great.
I wanted to take kind of maybe the last part of this podcast with you two and talk a little bit with our clients about you can't avoid periods of crisis. You can't avoid periods, what we might call crunch time. So what should effective managers do to kind of navigate those? I'll start off with a suggestion, and then you guys can jump in. But I think for me, it's not letting it feel like it's indeterminate. I remember reading a book. I can't remember which book it is, but I like to read books about. It was a book on. It was a Navy SEAL book. I can't remember which one. Whether it was like Lone Survivor or one of those.
Haven't you read like 10 Navy SEAL books?
I love those books. I know, and I do. I've read quite a few. I don't know if it's been 10, but it's been multiple. And there was a story about how they get through Bud's training and through Hell Week, and he said the commanding officer said that those that see the task as what's in front of them for the next 20 minutes, they're the ones that succeed. But those that are constantly looking ahead and saying, I can't make it till Friday, are the ones that fail. And so as managers, I think the key is to break down crunch time into milestones.
Yeah.
And also make sure that there is an end in sight. And even if it's 2 months of crunch time, make a 2-week period where there can be a victory, so that you can break it down into management milestones. But I'm curious as to what else you guys have seen effective managers do to try to manage, periods of burnout like this.
One thing I've seen that's really effective is just getting the team together and collaborating. So being able to, especially during crunch time, if you can take a 15-minute team huddle and say, okay, what do we got going on today? Who's doing what? Who can help out in whatever area? Who's got some spare time or whatever? Reprioritize. Then people feel supported. They don't feel like they're in this by themselves, and they've got some release valves here and there to kind of handle some of the spikes that they feel throughout the day.
One of our colleagues, Kristen, she used to put sticky notes, right? Mm-hmm. So everybody would, if they needed help, they would write what they needed on a sticky note, and it would go onto a big whiteboard in our area where all of our employees were their cubicles were.
Yeah.
And then if you had time, you'd look up and you go grab a sticky note and take it off the board. but it was like that shared, and she was good at that. I really admired her for that process.
That's great. I was just thinking of a client who's currently in the middle of an engagement survey right now. I spoke to the president of that company this week, and he talked about how they're doing lunch for their employees. This is a warehouse, a distribution company. And he talked about how he was kind of talking about just the cost of that. There is an expense to the organization, but he said that's the best investment he's probably ever made, just because of the impact it has in demonstrating we care about you, we hear you. Those little acts, whether it's done at the organization level or at the team level, a pack of gum at the team, it doesn't have to be something that's a full lunch or an expensive gift, but just those little demonstrations that I acknowledge that you're working hard and we care about you. I think that makes a big difference.
One thing I think you got to be careful too is don't pile on one person, the single guy who
your go-to.
Your go-to. Protect everybody. Don't play favorites.
Yep.
The other thing is you got to kill the niceties and the formalities and in crunch time, people are not interested in parties. They're not interested in FaceTime, not the app, but in, getting together. And you got to get rid of that stuff, because if you're going to ask them to do the work, don't ask them to do anything else. Those things can come back.
Mm-hmm. Yeah, and to your point about fairness, performance management is really important, because sometimes you see, if the favorite is getting all the work, they'll get burnt out. But if somebody's not pulling their weight, people notice that. And they notice when you as a manager are not holding them accountable to deliver, or, correcting them or bringing it up. So you have to be real diligent, deliberate in terms of making sure everyone's doing what they're expected to.
Yeah, Charles, I was thinking as we prepared for this as well, and your comment triggered this in my mind, is I think there's some overlap between the organizational network analysis that we've started to do with more and more clients, and this concept of identifying who's at risk for burnout. We have the whole idea of organizational network analysis is just identifying who are the go-tos when it comes to people thinking of I need a piece of information, or I need a mentor, or I need career advice, or those types of things. And essentially the output of that analysis is a kind of a spider chart where it shows densities and things, and whoever has the most connections basically is potentially the most at risk for burnout, because they are the go-to. People are constantly pulling on them, and especially in unprecedented times like we're in, if they've already been heavily relied upon, plus there's extra workload, extra hours, whatever that looks like, I think there's kind of an acceleration that they could be going over that edge soon. So
yeah, I'm glad you mentioned that, because sometimes these people are hidden influencers, not always, but they're hidden. They're overworked, and the beauty of that analysis is it helps uncover those pockets, and then you can put some effort into strengthening them and supporting them. So I think you're right. As people consider their burnout response, don't just run these questions. Consider, how am I identifying my hidden influencers? How am I helping to share the load? So there's a lot of things you need to consider as you approach burnout.
Yeah, and I think as I've seen organizations and teams action on this, sometimes they're burdened by a certain process that is inefficient, and so, but they just don't have time to fix it. So I'm in the middle of this. I still have to do this the same way, and I don't have time to go and get approval to change it or do something like that. Other times it's kind of a staffing need. We're just understaffed. We don't have enough headcount. And as a manager, you might have your hands tied because we can't hire right now. But maybe there's opportunities to outsource, contract some work, upwork some work, or get temps, or even interns that could help with your team. And so you can explore different ways that might not be the official path, but look for opportunities to kind of disperse the workload a little bit more. And also, be that buffer. Be able to say no sometimes to other teams or demands that you're getting, so that the capacity of your team and how much stretch they have, and be able to kind of be that buffer for them when they need it.
Yeah, that makes me just think back on something Matt shared earlier, just about the idea of having an end in sight, like having a date on the calendar that's kind of circled. Whether you have these healthcare workers or whoever it is that's just in this grind and there's no end in sight, something as simple as this is your half day off. So next Thursday is your half day off, and you're required to take at least 4 hours and go go be by yourself, or whatever that looks like. Having that on the date or on the calendar, having that date on the calendar psychologically, I think creates like, I can make it till that point. As a kid, my dad was a big runner, and he would, as he was teaching me kind of how to run, I was complaining a lot and not happy about it. And he taught me to just look at the next light pole, like make it to that pole. And then if you really want to quit, then we'll quit. And of course, get to that pole. And it's like, oh, look at that one. Check out that next pole. And just this idea of incremental pauses in the effort, I think can be meaningful.
It's great.
I do think that managing burnout is it takes effort. It's management.
Yeah.
It's not just rah-rah, and don't just go in there and bring a few donuts in, and don't just kind of say, nice job, team, and walk out the door at 5 o'clock. Think about these things like you mentioned, putting dates, creating milestones, building, find ways to share the load. Be involved, be present, and be a manager. Do your job. Exactly. Eyes up, do your job, and that's, I think, maybe my message or my final concluding thoughts is you can manage burnout, but if you just let it happen and you're haphazard, you're not doing your job.
I love it. Yeah, and I was going to add, people like to be stretched, pushed. They like a challenge. At the same time, they want you to care about them. So if they feel like you're pushing as a manager to make yourself look good or to hit some number that doesn't mean anything to them, they're not going to be as committed to it as if you're committed to their well-being and success as well. So, Spencer, anything else you want to add?
My last thought is just the value, to kind of build on what Matt just shared, of focusing on building high-quality relationships. I mean, ultimately, that's one of the best buffers, I think, to preventing and even managing, if it does happen, managing it effectively and recovering from burnout, is having a high-quality relationship at the core. So I hope managers will really place a lot of energy there.
Awesome. Well, guys, thank you very much. Thanks, everyone, for joining us, and we look forward to having you join us on our next podcast. Bye, everybody.